Good morning and welcome to the big show. It is Therapy Tuesday and we have Dr. Geraldine Tan from the therapy room. Good morning, Jerry.
Good morning. Missing all of you. Missed all of you.
Yeah, we miss you too. It feels like we haven't seen you in a year. Actually, it's been 2 weeks now.
that's
Just a
the
fortnight.
reason.
It's been 2 weeks.
It's been 2 weeks, but it feels like a year.
How is it you're prettier today than 2 weeks ago? What did you do?
She celebrated Mother's Day.
Are we on air or on Facebook?
On air, on
Oh, we
air.
are both.
Oh, happy Mother's Day, Dr. Jerry.
Happy Mother's
Happy
Day.
Mother's Day!
To all out there too, and to Angel too.
Yay. All right, Dr. Jerry, let's jump straight into it. We have a whole hour with you, if you will let us have that whole hour. Delusional disorders.
Yes, I was doing like all that research for a client, and then I was like, why not talk about it since I was doing all the research already?
So what are delusional disorders? Because I know I'm delusional.
No,
but
you're
what are
not delusional.
what are delusional
I think we're all a
disorders?
little delusional.
Depending on what we're dealing with.
No.
Yeah.
No,
This is a serious condition.
I thought it was interesting because and I tell you, when I miss all of you, I hear your voices. So I heard Angel saying how she was able to distinguish now, not just use depression for or depressed for every single thing. And last time we spoke, we made the distinction between panic attacks and anxiety attacks. So I was doing the research on delusional disorder, and then Angel's voice came to me again like, okay, yeah, but we always call people crazy, deluded, hallucinating, and psychosis. So all these words get thrown around, and we are not able to make sense of it or try to figure out whether it's a clinical issue or whether someone is just being naughty.
I have a question, Dr. Jerry. How often do you hear my voice? Do you need to see someone about that? I feel you might need to see someone about that. You keep hearing my voice.
Jerry sitting down to dinner and Angel's in the background going, delusional disorders.
Get the soup of the day.
Yeah, make sure there's
Buy the
loads of
bag.
vegetables in there in the soup. No meat.
No meat.
Actually, every time I take vegetarian food, I hear Angel like, oh,
See?
good.
Well done, Derry. Okay, so tell us a little bit about delusional disorders.
No, I'm not deluded.
Oh, okay.
But yeah, delusional disorder is actually, in the past, it was called paranoid disorder. So it is a mental disorder. Okay, so it's a psychotic disorder, and people cannot tell real from imagined. So when they have this disorder, they don't know what is real or what is fictional. I think we had mentioned or we had spoken about schizophrenia before, so we're not going to touch on that. But just very briefly to draw that difference for you is that for patients with schizophrenia, they can have delusions, okay? But a delusional disorder doesn't mean that the person has schizophrenia. Now, the nature of the hallucinations can be quite bizarre for the schizophrenics. So they literally see someone talking to them. They have auditory hallucination. They have visual hallucination, olfactory. So we talked about that, all the different senses before. And it's not there at all. So with delusional disorder is more confusing because some of the words that they say or some of the paranoia that they have can appear quite logical.
Okay.
Sounds dangerous, man.
Yeah.
Sounds quite dangerous. Okay, let's continue to talk to Jerry on the Big Show TV. Okay, in the meantime, here's Michael Jackson. At this point, At this point, let's just wish the president of the unofficial Big Show fan club.
Oh, yes.
A very happy birthday.
David Yo. Are
David
we
Yo.
ready? 1,
Happy
2,
birthday.
3. Happy birthday to you. Happy birthday to you. Happy birthday to
David.
Happy birthday to you. Yay! And many
Happy
more.
birthday, David.
Thank you very much, David, for all
Everything.
you do, all
Yeah.
your posts, all your creativity. We
Yep.
appreciate it.
Yep.
And we'll see you
And
tomorrow.
every week, without fail, he would do the poster for me.
Yes,
Yes,
he's very good.
every week. He's very good at that.
Jerry, so we're talking about delusional disorders.
Yes.
Siu Cheng on our Facebook page said, I was diagnosed to be one, and I had to spend weeks in IMH. Is this a hospitalization type condition? Do people normally get hospitalized?
Okay, so it must have been an episode that is a little bit more serious and causes perhaps a bit more discomfort for her. The exact details we probably would not know. Yeah, but it can range from very mild to very severe. The delusions can be mild and they can function, they can operate, they can even go to work. Yeah, when it is not troubling them too much.
But they have to take
Yes,
the
yes.
medication, though. I think that's very, very important because, I mean, for people who go to IMH, sometimes they're prescribed medication. And I've seen, cases where some of them refuse to take their medication, right, as requested by their doctors, and they suffer the effects again. So if the doctor advises you to take your medication, I mean, if you're watching us right now and at the back of your mind, you're always going like, no, I don't need the medication. I think you should take your medication until, your doctor says, okay, you don't need to take the medication anymore. But listen to your doctor. Right, Jerry?
However, you're absolutely right. However, these people with delusional disorder have no insight. They don't realize that they are having a disorder. So it is really the environment, the family that needs to help it to encourage them to take the medication or to seek treatment.
Can you explain something? I mean, for someone who suffers from delusional disorder, do they see things or do they believe things?
It's more a belief. Okay, so they don't have such overt, many of them don't have such overt sort of hallucinations, right? But they have delusions falling into 5 main categories, and it can all mix together, yeah? So one we know as in the past morbid jealousy. So
Wow.
that whole belief that this partner is unfaithful, and we have seen in the papers the result of morbid jealousy, where they kill either the partner or the partner's said, boyfriend or girlfriend. So it can lead, so the more severe cases, they're so steeped in that they carry out something to hurt someone.
Is that a delusion
But-
or insecurity, though?
That's a delusion
But it's
because
like-
you think the person is
So
fooling
it's a
around, but they're
disorder.
not.
So
Yeah.
it's an actual disorder.
It is a disorder.
Wow.
So it's part of the delusion where they believe so much that this person is unfaithful to me. They start reading signs. So that's why it's really hard to distinguish for these people themselves and for the people around them, because they will provide evidence. But it can be fictitious evidence. Oh, you see, this is a piece of clothing that she wore to meet the boyfriend. She definitely has that piece of clothes. Maybe there's a stain there, but
dear.
the fantasy in their minds is so great they fabricate something for themselves and believe so much in it.
Wow.
And that fabrication helps them justify whatever situations they are in, doesn't it?
Because they see things that aren't actually there.
Yes, yes, yes.
Yeah.
So
Poor
it
thing,
could be
right?
that,
Awful.
yeah,
yeah.
it could be something very innocuous, and they can blow it up to something really big.
How do you draw the line between an over jealous partner or boyfriend, girlfriend, whatever it is, and someone who's delusional with a disorder? You know?
So this delusional disorder has to be present for a period of time, at least for a month. Okay, very persistent, very consistent, and it breaks the relationship. Can you imagine in situations like that? The couple is not able to function at all.
And it's very dangerous. So what would you say to the person who is not delusional? How do they get out of something like that?
So we usually distance both of them. We keep them apart until the delusions are being treated, or the patient is being treated.
So
I
it's
mean, another example.
it's a physical separation.
Yes, otherwise this person might be in danger if it's more severe, right? Because there's no rationality in how the person is thinking.
Yeah.
We cannot argue with them because they have created a picture in their mind for themselves.
Yeah. You're gonna get stabbed though, FD.
No, I know. I'm just saying. I'm trying to understand this. So to them, it is real.
Yes.
Yes,
Yeah.
yes.
It is completely real.
I mean,
Absolutely.
I hate to stick on this subject, but because I've had over jealous partners in the past. But how does the person, I would call them the victim because they're at the brunt of it. Should the person stay with that delusional person, or break up with that person, or stay in the hope that this person will get better? You know what I mean? Because you can still love someone who is delusional, right? Or you stay because you're afraid. So what would you advise for someone who is in real danger? Should they stay because eventually this person is going to get better?
Wow, that's putting Jerry on the spot right
Well,
there.
well, she is the psychologist.
No, but
It's-
rule of thumb, if you are in danger, seek help. Keep yourself safe. If you're already breaking down, there have been partners that are completely traumatized. Then that's not good for your own mental well-being. And for yourself, you need to step away because then you would not be able to function yourself. So the ultimate decision of whether to stay or to leave is with this person. However, but if you are unsafe, don't stay in that situation. That would be my opinion.
Yeah, a person could strangle you in your
Yeah,
sleep.
In your
yeah,
sleep, you
absolutely.
would never
absolutely.
know.
Yeah.
Jerry, how young can delusional disorders hit someone?
Usually it is in their teens or early adulthood that we see it. Now, it really also depends if there's a genetic component, if there's a biological component, then that's where we see it. But I was doing research because I was looking at stroke, brain injury specifically, and that causing the delusional disorder to occur, and that can happen. So the correlation rate is actually really high. So we not only look at a personality change sometimes when somebody has a road traffic accident and has a traumatic brain injury, people after stroke, dementia, they can have shifts in their neurological functioning, and therefore it may cause a delusional disorder or schizophrenic-like symptoms to occur.
So trauma can cause delusion, as you said, like something, concussion or something like that. What about PTSD?
Post-traumatic stress disorder.
Yes, so it may have the symptoms there. You might hear the whole scene or situation happening, but that comes under the trauma. But yes, you can have some of the symptoms, some symptoms, but not. It doesn't fall under delusional disorder unless you start thinking people are out there to hurt you, to threaten you. So it comes under persecutory delusion. So that's another part of it.
Okay. Hold on. We're going for a traffic update. We'll come back and continue to talk to you. Okay, Jerry?
Okay,
Good
Jerry.
morning.
Morning. We've got so many questions coming through on our Facebook page. Prashant, who's been very active when you're on, asks, are anorexics and bulimics and those who think they have some sort of medical issue, is that another form of delusional disorder?
If we talk about comorbid, can they come together? The two disorders can come together, but it's not very common for the anorectics to have that. They have their own obsessions, they have their own compulsions, yes. But can it come with delusions? Yes, it probably can comorbid together. Now, the other one that he's talking about probably is the hypochondriacs. So hypochondriacs, they are fearful of the medical conditions and everything. Can it be a delusional disorder? Yes, it's one of the areas of delusion where they feel that they have a physical defect or a medical condition. So we have had plastic surgeons send patients to us because the patient goes, my nose is crooked, my nose is crooked, my nose is crooked, and they have done many plastic surgery on the same part or various
dear.
parts because they still see that their face is not symmetrical or
Right.
not
Wow.
to their liking. Yeah, and the doctor says I cannot do anymore. But I think this person, so it's really interesting because basically the doctors say, I don't want to earn your money anymore. But there is something else going on. Please go and see someone else.
Oh, wow.
Wow.
Oh, dear.
Wow.
Yes.
Okay.
Yes.
CFD, not
Yes.
everyone has a big nose like you know?
I know.
With a nice bridge. Yeah, some people want, your nose.
That is
Who
true.
the hell would want my nose?
You'd be surprised. You'd be surprised. Okay, so Dr. Jerry, you were speaking about the different types of delusional disorder, and you mentioned morbid jealousy. What else is there?
So there's jealousy, there's persecutory. We spoke about the somatic, so that's the physical one. With the lovers one, there's erotomanic.
Erotomanic.
Where
What is that?
Yeah, where the person believes that this other person is in love with him or her.
Oh, wow.
Yeah. And it leads to that behavior of you're doing this, therefore you love me. So how can you go out with someone else?
Oh,
Oh, wow.
wow.
Yeah,
I'm sure you've experienced that before, Angel. Some of,
Actually, no,
No?
No, not to that level. Not to that level. No, I haven't. Thank goodness. No, but yeah, I've experienced equally something stuff.
I think we all have, right?
Yeah, to some extent.
Yeah.
Stalkers, yeah, but not to the
the
extent of them believing that I was theirs and stuff like that. No, thank goodness. Okay. Yeah.
So stalkers are not a delusional disorder?
No, not all of them are. It can be other things. I mean, it can be a simple breakup, or it can be someone that's grieving, or yeah, it doesn't have to be a delusional disorder.
Okay.
We continue to talk to Jerry on The Big Show TV. In the meantime, here's...
All right. So
What
you
else
got
is
some-
there on the list?
Grandiose. So the belief that they are someone great, someone fantastic, they have this inflicted sense of self-worth that, oh, everybody is looking at me, I can do anything, I am better than you, sort of belief.
But isn't that a
Yeah,
way
in
to
terms-
pump yourself up to give yourself confidence?
Self-confidence, yeah.
Where's the line between that and like ego?
Yeah.
It's to the point that they would not put someone down. Yes, sometimes they do put people down, okay, but they feel that they are the only ones that can do certain things. And whilst there is a little bit of truth, it doesn't mean that they really can do it. So they are deluded in that sense. So they actually may not have that wealth of knowledge or that magnitude of power to be able to conduct something, but they believe that they have.
can,
So
right.
they have something, but not a great
Enough.
deal of it.
I think
Yeah.
there's some people on reality shows that are like that.
Yes.
That have this delusional disorder of grandiose. This whole thing where they feel like they're up there and they're better than everybody else and they can do stuff, but they actually have nothing to back it up.
Adrian on our Facebook page has got a rather interesting thing. He talks of delusional disorder and split personality. Is there a relation?
So split personality is a disorder by itself. So we're really just targeting that package of delusional disorders here. Yeah. And split personality, you run through different personalities. But when you're deluded, you are one personality. You just have a belief that probably you've magnified it so much that it causes an impediment or impairment in your life.
Is schizophrenia the same as split personality?
No, it's
Oh.
different.
Wow, okay.
But, yeah, so schizophrenia is really big, broad umbrella, yeah?
Right, okay. With many
So it's
different things
all-
underneath.
Correct. That's why it was all very, very confusing. I was looking at schizophrenia, I was looking at delusional disorder, and then I was looking at something interesting because I found, some of the symptoms also overlapping with paranoid personality disorder. So I was like befuddled. I was like, oh my gosh, so many different things.
Because earlier you
Yeah.
mentioned that delusional disorder used to be called paranoid disorder.
Yes, but this is a personality disorder, so
Wow.
slightly different. Yes, so the delusional disorder is not a personality disorder.
So calling someone crazy is no longer that simple, right?
Yeah, it's not.
No, it's
Exactly.
no longer trendy at all.
No.
So you
Yep.
need to go and figure out.
So that's why we're not playing that song by Madonna. Is he crazy for you?
Because
We're
it's not
playing that.
politically correct.
It's not politically correct.
It needs to be like, I'm delusionally in love with you or something like that.
Maybe she drives me crazy. Fine, okay. See, we don't play that anymore.
She drives
Just
me.
think about all the songs, mad, crazy, and all. We don't play.
She
those-
drives me
those-
overly possessively in love with her or something like that.
Jerry, we've talked about grandeur, but the delusional disorders can also be on the other end of the scale. I'm not good enough. I can't do this. It's impossible for me to do.
That's
It can
just a lack of confidence, lah. That's all.
Couldn't it
Right.
work on the other end of the scale as well?
It's an interesting point. Usually we don't look at it that way. It can be depression. So the depressiveness can come with psychosis. There's psychotic depression. So I think I mentioned in one of our chats before, there was the young teen that came and she was really, really depressed. And she could see potatoes jumping in my room.
Oh, wow.
Oh, wow.
But she has no delusional disorder. She has no schizophrenia. She was really depressed with psychosis. Postpartum depression also can come with psychosis, where sometimes mothers, and this is really really sad, they deliver the baby stillborn, but they think they hear the baby
Oh dear.
crying.
Oh, yeah. There is actually a show on Apple TV called Servant,
Okay.
which is exactly like that, where this woman lost her
Oh.
baby because she had left him in a car or something like that, and she ended up getting a doll because they have these dolls that are very lifelike that help women who have lost babies to kind of
Yes.
bridge that. Anyway, I wanted to go back to what you were saying with trauma can cause delusional disorder, as can genetics. What other causes are there behind delusional disorder?
So I think Suchin wrote hereditary. So the genetics, it can be biological. There's a shift in the chemicals in the brain, and that can also cause. So those are some of the main causes of delusional disorders. It's
Hereditary.
interesting because yeah. It can also be exacerbated because, as I was reading, right? So, the paranoid personality disorder. So, if you already kind of have a base with that, it can also be exacerbated after trauma too.
Interesting.
okay.
You were talking of crossing over. Damien asks, can delusional disorder cross over to narcissistic disorder?
That is an interesting. So, we would want to also see whether what is the pre-morbid sort of personality. Yeah, and sometimes it is the pre-morbid personality that also forms the basis why we diagnose them, but not always, because someone with brain trauma can be completely a different person from before. So a mild and meek person can be very aggressive and very brusque after a head injury.
Will that be considered schizophrenia or a split personality after that? No.
No,
Okay,
no,
okay.
because there is an event that happens and then the symptoms occur.
So if you haven't met a friend in a long time and suddenly you meet him or her and all of a sudden they seem different, is it okay to just go like, you got brain damage? Or?
Oh no,
Glenn!
no,
No.
my goodness, no.
What do we do with
You
this guy?
know when Glenn is like drifting off and then he comes up with one super
Yes.
random statement.
Yes, he's falling asleep now. Yes.
No, I'm not.
She said drifting off.
I'm not falling asleep.
Drifting off means
Because-
falling asleep. Yeah.
But I mean, she's not completely wrong, because I mean this particular topic, right? I mean, you can't make fun of too
You
much.
can't.
No,
You
you
can't.
cannot. Not too much
oh,
at
I
all.
mean at all.
Choose your words carefully.
That's why I'm quiet.
We keep telling you, think before you speak.
I might open my mouth again. I might get into trouble. Okay, baby, hold on. Let's go for a traffic up.
We got Adrian Tan on our Facebook page who goes, wait, I got to do this. It's a very interesting topic today. First statement.
Okay.
Second statement, Glenn Ong, delusional.
What did I do? What
I
did
think
I
people
say?
have said that about you before,
Okay.
on our Facebook.
But this
yeah.
morning I'm not, right? I
No,
mean, I
no,
didn't display any
No.
No, it
any
only
sense of
delusion.
grandiose or
No, it comes out every now and then.
Really?
Not all the time, yeah.
okay.
So it's okay.
I'm basically a very chilled out person.
Basically, yeah.
Jerry, I want to go back to the parents here. You said that delusional disorders can start from as young as a teenage age. You also said that if you're in a relationship where this delusional person with a delusional disorder can get violent, you should get out of it. What do parents do when their kids suffer from delusional disorder?
Bring them to the doctor. They
But how-
have the power, they have the authority to do that.
Okay, but then how do they?
No.
So you're saying. I don't want to use the word commit. You're saying put them in a hospital or still keep them at home?
No. It's so delusional. Whilst we talk about delusional disorder as something so strange and far away, in actual fact, they can, for the milder to moderate ones, if they keep their the thought processes in check, if they learn how to deal with that thought processes, they actually can function very well.
But what kind of kids are we talking about here? I mean, what
Kids who have a delusional disorder and may be violent.
like what? Jerry, could you give us like some examples? I'm sure you've come across some of these children. I mean, now we're talking about children, not adults.
She
Oh,
said
teens as well.
We're
Teens,
talking
yeah.
teens.
Teens and young adults, right?
What are
So
some
the teens and young
examples?
adults- some of them are in university. They are studying. We learn about what their stresses are. Sometimes it could be a very intense period of time, and they're not sleeping well. They're not eating well. Perhaps they have been cooped up in the room for too long. So it can be various, even simple things that trigger them, and they don't know how to regulate themselves, or they start sitting with their thoughts and their thoughts start growing. But if they come for therapy regularly, they work through their thoughts, and we are able to catch some of their thought processes that are a little bit delusional and work through with them. They are able to function quite well.
So speaking of growing, can delusional disorder get worse? I mean, you talk about it being very mild to very severe. If it's not kept in check, obviously it can get worse. But at what point does a parent or does anyone take their kid to see a professional?
Well, if you already realize that there is something wrong with the child, or with the teen, or they are not functioning, so your indicators will be there. They're not functioning. They're irritable. They are telling things, and no matter how you rationalize with them, it just won't go away. They are really miserable, or they are trying to plan revenge, or trying to plan something. Then I mean, at that point, I don't think the parents should be managing themselves.
Yeah.
Go get help.
Yeah.
There is
Can you
help.
imagine
Go
your
get
kid coming up to you, "Mommy, I hate you."
Yeah, the kids do that all the
Yeah,
time.
sorry,
though.
sorry. I
Yeah,
mean,
yeah,
no,
yeah.
in a different voice. "Mommy, I hate you."
With
Then,
a,
okay, that's-
with a knife as well. Yeah, that's a problem.
That's when you send your kid, to a doctor.
Okay, I want to ask you another question on the Big Show TV about stress, because you mentioned stress earlier and kids going through exams and stuff like that.
Wait, hold on. Are
Yeah.
we on? Oh,
Not really.
We're
I
on
see. I thought we were
air
on
right
Facebook
now.
Live.
No, we're not. Yeah.
Okay, I take back what I just said.
Okay, you can't. You
So
can't.
sorry
It's
about
forever
that.
out there.
All right, here's Neon Trees with Animal.
Dr. Jerry, just now you were talking about teenagers that you've seen. Some might be going through exams. Some might be very stressed. Can stress bring on delusional disorder?
It doesn't bring on, but it is a trigger. That means
Oh, right,
that,
okay.
when they already have it, it can exacerbate the problem
And
or the
you
condition.
and you said it's also possible to be hereditary.
Yes.
What is the percentage of people who have delusional disorder passed down to them? Is there a number?
No
There
way.
is-
Yeah, that's
Yeah,
what she said.
I
It's
don't
hereditary.
have- Yeah, she
It
said.
can be
Yes,
hereditary.
there is the number. I don't have the number. I'm
Okay.
so sorry.
No, it's okay. Is it very high or is it very low? I mean, what are the chances that a kid, has parents that are delusional
I
and
hate
they're
this
gonna
whole
get that
hereditary thing.
I know, yes,
You know
so
what I
do
mean?
I.
It's not the fault of the
of the
kid.
child? Yeah,
But
yeah.
it's like
breakable,
Yeah.
right?
Huh?
I mean,
It is breakable.
Is it breakable? Is something like is the chain breakable?
well, I believe it's breakable.
I do as well.
I do as
Yeah.
well.
Research still goes on.
Yeah, exactly.
not
It's-
sure.
I mean,
Yeah.
and that's why we have the researchers looking at whether we are able to modify some of the certain parts of the DNA.
Wow.
Yeah, but I think also if it is hereditary and one of the parents say has delusional disorder, I would imagine that they would be able to pick up the signs in the child a lot quicker, wouldn't they? So the child could probably get treatment a lot faster.
So we would be on a lookout, especially when they hit the teen years. Yes.
Okay,
absolutely.
so it doesn't start with younger children. Oh, it's very, very rare.
It's not impossible. It is, but it's not very common.
Because FD used to have an imaginary friend.
Yes.
Who's to say he wasn't delusional at that
Yeah,
age?
remember that friend?
Yeah, remember
Yeah.
that friend you had?
Of course he was
I know.
delusional.
Yeah.
There's no such thing as an imaginary friend.
He still talks to this
Exactly.
friend every now and then when we're not looking. See? There? See? he feeds it as well.
Something
but-
is wrong with this fella.
No, but
you know?
is that a disorder?
Yes, I think it's a disorder for a 66-year-old man to have an imaginary friend. No?
Dr. Jerry's like, can I leave
How
now?
old is your imaginary friend, by the way?
Does he grow?
No.
Is
Dr.
it he
Jerry's
or she?
keying in a schedule
She?
for him already.
It's a she. What's
It's a
her name?
she.
What's her name?
It's a she, but we talked about
What's
that.
her
Annie.
name? Annie, no.
Annie, right?
Annie. Oh,
Yeah.
wow, you remember Annie. Have you met Annie?
No, but he spoke about it before.
Which guy has a female imaginary friend? Even as a kid, let's say, if we had imaginary friends
Yeah.
as guys, it would be a guy imaginary
Okay.
friend,
Yeah,
not a
he-
girl
Here
imaginary
is where,
friend.
and Jerry, I just want your comment on this. Here is where I think it was my parents.
That created this friend?
No,
Oh.
that caused me, that caused the friend to be female and named Annie. I'll tell you why. Mark Anthony Van Kylenberg. Mm-hmm. Okay. Mm-hmm. What was my nickname?
Annie.
Marky?
Annie.
Why?
Anthony.
Oh,
Anthony.
Anthony's not
I
Annie.
know,
Yeah, but-
I know, but it became a nickname.
Why not Marky?
I don't know. but
Annie was your nickname.
It was a nickname.
Really? How old did that follow you on for?
Ooh, till I was about 9.
Wow, okay.
Yeah.
Annie.
Annie.
And maybe that is why my imaginary friend was female, and I named that friend Annie.
Next time we print T-shirts, it should say Annie then, no
That's
longer
so bad,
FD.
don't.
Right? Is it ANNIE?
Could that be? Could that be, Jerry?
Is that possible?
Could that be?
It's your imaginary friend. Can we not try and psychoanalyze your imaginary friend?
Oh, okay.
But this was like in the 1940s, you know.
No, it wasn't the 40s, please.
Sorry, what is it? 19
He wasn't born in the 40s.
Exactly. This was
But
the
what I
early
mean is,
60s.
you see, it's so unusual because, I mean, he said, right, it's his parents, probably
I
because
said
of his
it may have
parents.
been, yeah.
Because, you know, I mean, during my time growing up, right, as a boy, right, my parents would buy me things that are blue
G.I.
in color.
Joes
You know,
and-
it's like, yeah, even if it's toys, it's got to be like
Military
toys for
stuff and
boys.
boys, yeah,
You know what I
boys'
mean?
toys.
They would never call me by a girl's name. But
Yeah.
his parents seem to
Nickname.
have done that.
Yeah.
Knowing full well that he would feel like he's being
Bullied?
no, not bullied, but being called by a girl's name. I wouldn't have stood for it, no. If let's
But
say
how-
my
But he
parents
was
called
a
me,
child, though.
I
He
was-
was a
no,
kid.
no,
Little
still,
kid.
I'll go like, hey, I'm a boy, not a girl. Why are you
But-
calling me
yeah,
Annie?
but I mean, when you're a child, like say you're 2 years old, you wouldn't even know that the name Annie
two?
is a girl's
Well,
name.
I
He
don't
said
know.
from a
Nine.
kid.
I don't know
Till he was
how
9.
young
Yeah.
it started, and I don't remember ever questioning my parents about it.
Yeah, because you just
Why?
I
you
ju-
get used to it.
It was something they called
You question everyone about everything now.
That's now, but at that time I never questioned.
Oh, okay.
So I'm just saying maybe that's why.
Okay,
Maybe,
then Jerry
yeah.
is analyzing the both of us.
Why
now.
did it
Yeah,
stop? Why did the name Annie stop then? You said it stopped at 9.
I don't know.
It
They,
just-
as I got older, they just stopped.
Anybody calls me Annie, I'll give them a punch.
Your name's not
Okay,
even
sorry.
Anthony. How to
Will
go?
Smith them.
I know what I'll call you. Fran.
Frankie?
Fran.
Franny.
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 Oh,
But Jerry, so Jerry, don't over.
Analyze.
Over-
No. We all have our childhood toys. We all have our imaginary friends, and you know, yours is just imaginary because we have nothing tangible there. But you know, we have teddy bears. We have soft toys.
Same thing.
And kids speak with them, kids speak to them, have a conversation.
Yeah.
Adults have conversation with that. I know one of my clients, and she has a beautiful Julie the monkey, where the monkey helps her through the grieving process, and she speaks to the monkey. Are we saying that all these people are deluded? No, I
No.
don't think so.
It's just a
that's
tool.
fundamental.
You know, I'd love to
Yeah.
speak to Glenn's mom and find out who he was talking to when he was a child.
No,
You know,
I never had the imaginary
yeah,
friend.
I would love to
that's
speak
a
to her.
I had
and
a
say-
brother. That's why.
It doesn't
That's
matter.
true.
He had a
Oh, you had a
brother
brother
too.
as well.
Hello.
Brother.
It
I had a
wasn't
dog as well.
I had a dog
we
as
go
We
well.
had
there.
six.
Stand by.
Yes, I had a rabbit as well.
This is our last.
I had a hamster as well.
Oh, wow.
Good morning, Dr. Jerry. So we were just talking on the Big Show TV about imaginary friends, and
Sorry.
does that mean that one suffers from delusional disorder? And Dr. Jerry gets up and grabs her imaginary friend.
No,
It's a puppet.
It's a puppet. No.
It helps me.
okay.
Ah, there you go.
It's a raccoon.
Okay.
Okay. And
Your ventriloquism is brilliant.
yes, should send you to Sean Chua.
Okay. So that's so what do you use that puppet for, Jerry? The kids who come and see it.
So not only the kids, sometimes the teens, right? Whoever else. I mean, yeah, it just helps them to project, or they use the puppets as a mouthpiece, or basically play therapy. So we use play therapy in session also. Yeah.
Okay.
Yeah, so it's part of that whole coping mechanism, the whole developmental process. Stop picking on FD, Glenn.
No, I don't think he's picking.
Glenn?
He just doesn't understand.
Like what? Female imaginary friend? Did you at least kiss her? Did you
No.
kiss her?
No.
Did you kiss your imaginary friend?
It was a subconscious of him, right?
Yeah.
This is like an alter ego, right?
Yeah.
Almost.
I don't know. I can't explain it. But Jerry, just one more thing that I want to bring up. We have said already that people who have delusional disorder don't necessarily know that they have it. Because remember we had Siu Cheng who called and said that she spent time in IMH. She said, I was there even though I didn't have the symptoms.
Okay.
Is that just denial of the disorder?
They have sometimes they have no insight at all. Most of the time, they have no insight. Yeah, so they go there, or they go in, or they seek for help, and they will literally tell you, "There's nothing wrong with me. Why am I here?" And that's why they also do not take their medication. So it's really up to the environment, up to the family to ensure that they take the medication. Or sometimes they say, "I feel better now," and they stop taking the medication even before the doctor discharges them. Now that becomes really dangerous.
I just want to say something to Su Cheng. Su Cheng, hang in there. I think what you're doing is great. You've gone to seek help.
Yes.
And I think you're wonderful. I think you're a role model for anyone else who might feel like they need to talk to someone, they need help. So keep it up,
Really good.
and I hope you feel perfectly well very, very soon, Su Cheng.
And thank you for sharing, Su
Yeah.
Cheng. That was very
Yeah.
brave.
Yes,
But
very, very
very
brave.
brave. Dr. Jerry, I just wanted to ask you: is it possible for someone to get over to get better without medication and through something like hypnosis or some
So
sort of
it is
therapy?
It is a chemical issue. We want to work at the conscious. I mean, it's already a very subconscious disorder. So you want to work on it at a very conscious level.
Oh, right. Okay.
Yeah.
Okay. So no. The answer is no.
I think hypnosis is as real as the Care Bears, I think.
Oh, what do you
so
mean the Care Bears are not real?
Care Bears are not
Care
real.
Bears there.
So wait a minute,
One-
Jerry. Are we saying that once you
Yeah.
have delusional disorder, you will always have delusional disorder?
And be on medication?
And be
Will
on medication.
Managed. Oh, it can be managed. So the antipsychotics can help you. The cognitive behavioral therapy, family therapy, individual sort of therapy can help you. Yeah, but the symptoms can be managed. It may not completely go away.
Okay. Wow. Okay. Anything else?
Yeah, I just want to
It's
say.
quite amazing.
So Jerry, I still can't see you, huh? As in, like, you refuse to
Conflict
see
of
me because
interest.
why again? Conflict
Conflict of interest.
Why?
Yeah, yeah. You can see one of her other therapists because she knows you.
Yeah, she can't.
Oh.
Because
She cannot.
She knows
It's
us
too
well.
personal.
It's too
Yeah,
personal.
it's too personal. But you can see someone else from her.
Now, why do we go
in
out
the
and talk to
therapy.
our friends then? Sometimes we
But
treat
they're
our
not
friends as
professionals.
therapists. Yeah, but we do treat them as therapists,
Yeah,
right?
sometimes.
Why do we do that
Yes,
then if we
yes.
know they're not going to give us.
the correct information?
Yeah, exactly.
Because it's therapeutic to speak to people. It may not
just get it off your
necessarily be
chest.
So that's why I say I
professional.
want to speak to Jerry because Jerry's a friend, right?
Oh, right,
And
okay.
she's qualified.
Yeah, you can speak to her.
Unlike
You just can't sit with her in that room
Right.
and pour your heart out. But you can do it over a glass of
I might
wine
not-
somewhere else.
I might not be objective enough. I might be more subjective. I'm more
Yeah.
emotionally invested.
Yeah.
I might ally with you a bit too much in your troubles, and that's why sometimes we speak with a therapist and not with a friend. But it's a very very interesting comment that you make, because I had a session with a Russian lady, and she was sharing about the culture and how it was very difficult for her the last a few years when she was in Singapore and could not go back to her country. Yeah, she said the Russians have something called kitchen talk, where they start to talk to their family members, they talk to their friends, and it felt really good because they just let things out. And she wasn't able to do that these 2 years. So she cried in my session yesterday. She said, for so many years, no one was listening to me. And you're the first person after so long that I could just sit there and speak.
Oh,
Yeah.
you were her kitchen talk then.
Yes.
Yeah.
Well,
But
more than that, I
we
hope.
we don't quite do that with our families, right? I mean, we hold back a little bit. We don't like
Different
Yeah, I
families
share a
have
lot with my
different,
family.
Yeah.
In fact, I share just about everything with my family
that's good.
I think that is one of the things I miss
about family.
about having my parents around and my brother around, my sister around. It was
surely
that.
you weren't that close to them to the point where you share everything.
Oh, if
That's
we had
quite rare.
problems in school, it would be talked over at dinner.
Yeah.
If I had problems with friends, it would be talked over at dinner.
Yeah.
Yeah, it's very different with extended families.
Them
you know?
calling you Annie, do you talk to them about that over dinner?
No, it had stopped by that point. I'm talking about in my teenage years when we used to carry on these conversations.
Yeah.
So it's something I do miss.
Yeah, and different families have different
Yeah.
ways of communicating.
Upbringings,
Some don't
yeah.
communicate at all,
Yeah.
which is sad.
It's not like
but-
me and my mom. Whatever she says, I just do the opposite.
Okay.
Usually it
that's
turns
different
out
as being
fun.
a rebel.
But my advice to anyone who wants to start to instill that, the first thing you've got to do is when you sit down in the kitchen or at your dining table, get rid of
Of
the
your
damn
phones.
mobile
Yeah,
phones.
get rid of your devices.
That's the first
Yeah.
thing you've got to
And
do.
don't put devices when you're eating as well. I mean, that's
I
that's-
won't agree with you guys. I
Okay.
think that's the old-fashioned way.
That's it.
These
The
days, I think you
old-fashioned
just
way,
sit
they
down.
didn't have
you
devices.
Just sit down, and do whatever you want. Multitask, if you can focus and concentrate, that's the best.
Don't listen to Glenn. This is why he's not a psychologist.
Okay, all the young people tuned in. I'm not with these two, okay? yes. I'm like y'all. I do what I want, right?
Any final words, Dr. Jerry?
Yeah. And if you're feeling down, like last night I was feeling a bit down, I just want to say, just grab a beer. You feel okay.
Oh.
Again,
I was
don't
feeling
listen to
down
Glenn.
last night,
Oh, why?
because the doctor told me to not go to the range. I'm playing this today.
Yeah.
Usually I'll practice almost every day, but I hurt my elbow a little
Again.
bit. So so I was feeling a little
Your
down.
doctor told
I
you
was at
not to
home.
go yesterday, is it?
Yeah, because
but you're going
my
today.
doctor is my uncle. see.
Oh, but you're going today.
Yes, I'm playing today.
Oh, okay.
Yeah, I'm out on the course.
So
today.
did he mean only don't go yesterday or don't go
No,
today?
actually, he
as well?
said, Glenn, take a break from golf. I'm like, oh, but I'm playing tomorrow. I'll rest after that for a few days.
Sure you
So,
will.
so anyway, what I'm saying is, sometimes you're feeling down, and I was like watching TV, and I was like, I want to go to the range.
And you
right
had a
now.
beer.
Just like, and then I grabbed a beer, and after I felt okay, I felt good.
And fell asleep.
Yeah.
That's not something you would recommend, though, right, Jerry? Am I borderline
Turning to
alcoholic?
alcohol. Turning to alcohol.
No, right? But
I don't know. He has alcohol in the afternoon. If
He does.
He will have alcohol in the morning.
Did he have a drink with you when he had lunch?
He had the drink. I had the
Of course
water.
he did. Yeah, of course he did.
I had a beer. One drink a day. That's my my
Minimum.
rule. Except when
Your
I'm on the
minim-
course, then
your
it's different.
minimum.
Yes. No. One drink a day. I
Is your,
really do.
is your minimum?
It's my maximum. No, I'm serious. I go out with you guys. I binge. Yeah.
Don't
if
blame it on us.
But when
Yeah.
I'm at home, I'm alone. It's just one.
Is it one bottle or
No,
like,
it's like one can, one beer or one
Guys, this is
stout.
not
or,
Friday with Sito, no?
a highball or whiskey. But it's got to be. I mean, a wine. It's got to be one, just one.
Jerry, I know we've spoken about this before, but I just want to bring it up again because I think we've got a new listener. As a psychologist, is there or do psychologists take the word used is a vow. You know where you promise to keep things
A vow of celibacy.
confidential, blah 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 blah. Do psychologists do that?
Yeah.
You would have
So
to,
there's
right?
a patient confidentiality. Yes, we maintain that. So we don't volunteer any information to anyone without the permission of the patient, unless they're going to hurt themselves, hurt someone, kill themselves, or kill someone. We will breach confidentiality.
Okay.
So if you speak to Glenn, we can't come to you the next day and say, "Hey, Jerry, what did you say? what did Glenn tell you?"
Yeah, because
But
we
you
really
see,
want to know what
not
he's.
my client.
We really want to know what he says behind our backs.
She can because she's not a client.
Okay, so
Oh,
she
yeah.
can tell us everything.
Hey, you know what'll be fun?
Alright.
One of these days, we sit in a circle, okay?
Circle
Right?
of truth.
Yeah.
Campfire therapy.
Jerry sits in the middle,
She sits in the middle.
yes, you know, I mean, we
Like
just
a human sacrifice.
Can we put her on a
just
lazy
gather
Susan?
around.
We put her on a lazy Susan so we can spin her as well.
Have you ever done that?
What? Sit in a circle?
Sit in a circle and really talk?
like
No.
those people, Alcoholics Anonymous. That's what they do.
Hi, my name is
harder.
Angel.
It's harder than you think.
I'm
It depends
sure.
on why we're there, lah.
Because you have to be 100% honest.
Okay.
It's harder than you think.
I'm always honest. What?
That's true.
Okay, Dr. Jerry is still here.
Yeah,
Yes.
last words. Jenny.
Last words,
Everybody.
last
Yeah.
words.
Okay.
And I want to have Shaun to help me to read. So it's a little script from A Beautiful Mind. So for those that haven't watched it before, can watch it. It's about this mathematician that is really intelligent but has schizophrenia. So it's a really lovely movie.
Russell Crowe,
So,
right?
Russell Crowe, yeah.
Yes. So it's just a little snippet, and I'll play Alicia, and Shaun will play
Oh.
Nash.
Wow.
Oh, wow. Okay.
And
So
scene.
how big is the universe?
Infinite.
How do you know?
I know because all the data indicates that it's infinite.
But it hasn't been proven yet.
No.
You haven't seen it.
No.
How do you know for sure?
I don't. I just believe.
It's the same with love, I guess.
Wow.
You almost look like Jennifer Connelly, you know.
Wow.
I love this. Very nicely done,
Okay.
Shaun and Jerry.
Awesome.
Leaving everyone with that, and have a beautiful week ahead.
You too,
Thank
Jerry.
you. How many weeks were you guys rehearsing for that? By the way, just
Many, many weeks.
This is why he sees her all the time. They have lunch and everything.
that's true. That's
Yeah.
true.
Play theater.
Wait, but you're not seeing her, right?
No, no, no.
Angel is jelly.
I
Angel,
am.
don't be jelly. I'll have lunch with you.
Yay!
Don't be jelly.
Okay. All right. Thank you so much, Jerry. Have a wonderful week ahead. We will see you
You too.
next Tuesday.
Next Tuesday.
First day of work.
Bye.
All right.
Bye.